Hey nurses, we're back with part 2 of our Master the Moves mini-series. And now that we have our conventions out of the way, we're going to knock out each question individually. Again, my goal is to help you complete the OASIS efficiently, meaning both quickly and correctly, and I'm optimistic that these suggestions will help you do just that. So with that, let's get started with M1800. M1800 requires us to assess our patient's ability to safely wash their face and hands, style their hair, shave or apply makeup, as well as their ability to perform teeth or denture and fingernail care. And even though it's not clearly defined, we're also assessing our patient's ability to safely access their grooming utensils and their ability to safely get to their grooming area. That small caveat in itself changes the entire dynamic of how we look at our grooming move. So, with quite a bit to assess, I try to look for easier ways to correctly code my responses, which is why I like the technique of scaling my move from independent downward to dependent. This way, I can quickly gauge where it is my patient will most likely fall, because I can envision a green zone being there for my independent patients, a yellow zone for my patients that require some type of assistance in there, and a red zone for my patients that are strictly dependent. Therefore, if I have a patient that is unable to groom without assistance, I already know that I would be outside of that green zone, prompting me to ask myself, does my patient need assistance to safely gain access to what they need for grooming or to get to and from their grooming area? And this does involve needing someone to bring the items to them or needing assistance to get to their grooming area that has their grooming aids, mirrors, the sink, etc. I also want to ask myself, does my patient need assistance to safely groom once they have what they need? And if that's a yes, then I've progressed to response 2, because now my patient requires assistance with both access and performance. So just know, once we move beyond just simply placing the items within reach, and we're to the point that we're providing standby assistance, verbal cueing, we're screwing off caps and loading toothbrushes, all that type of good stuff, then we know that response 2 is where we need to be in that yellow zone. Now, if my patient just needs another individual to flat out complete their grooming tasks, so someone is strictly doing as opposed to assisting, then I'm going with 3 as my answer. And a good example of that would be a bedbound patient with right-sided paralysis to that dominant side, thus leaving them dependent on their caregiver for overall grooming. And having reached this point, I think we've laid a pretty solid foundation, so this would be the ideal time to focus in on our conventions in a bit more detail, just to ensure that we're compliant with CMS guidelines. So beginning with ability and safety, I just want you guys to remember, it's not can my patient groom, but instead it is can my patient groom safely, which entails patient access and task completion. And if they in fact are unable to safely groom, then our goal is to fix whatever it is that's not allowing them to do so, as best we can. Now, with relation to our time frame convention, again, guys, don't harp on variability and don't overthink the concept of what can they do more than 50% of the time. And let me tell you why. CMS recognizes observation and or demonstration as the preferred method. So I want you to use your assessment skills to code the best response based off of what you assess on the day of care. Also, keep in mind that CMS tells us that we do not have to actually see our patient comb their hair or brush their teeth to respond. Rather, as we assess our patient's coordination, their dexterity, and other physical and cognitive features, we should be able to evaluate what it is they're currently able to do the majority of the time when it comes to safely grooming. Moving on to our majority of tasks convention. In cases where there's variability, I would more so code the response that best describes my patient's ability to perform facial, hand, mouth, and hair care, because these should be done daily. And hence, they're the majority of the more frequently performed tasks. So as a quick example, if my patient only needs their grooming supplies to be set up for 2 of those 3 tasks, then I would record 1 as my response. However, if my patient requires someone to provide assistance with grooming for 2 of those 3, then 2 would be my correct response. So I hope you can kind of see the correlation there. However, if you do need more clarification, don't hesitate to ask, because I'd be more than happy to help. Last but not least, Remember that you are allowed to collaborate and receive input from other members of your agency staff if they've had direct contact with your patient, thus summing up our convention requirements. Now, as we bring everything full circle, I just want to advise you guys to always look at your patients holistically. It's nothing wrong with being an investigator and finding those unsafe factors that impedes on their ability to safely groom. So in essence, we're looking to see if their poor coordination, their pain or shortness of breath is impairing their ability to stand, thus making it difficult for them to safely groom. We're assessing their grooming areas for low sinks or cluttered pathways and narrow entrances that don't accommodate their walking devices. We want to take into account lacking resources or the lack of assistive devices present in the home. And we also want to evaluate their cognitive status and that they may have advanced dementia or even schizophrenia, for example, that may leave them totally dependent on someone else to safely groom. And so these are the type of impeding factors that we want to continuously assess for during our time in the home because they play such a major role in how we code our moves. Most importantly, we want to be positively intervening to resolve such impediments to the best of our ability. And with that, guys, I think we crossed our T's, we dotted our I's, and I'm pretty sure we covered all of our bases. So my only hope is that this has been insightful, a bit unique to the ear, because I know you guys have had tons of training on this, and that it will make your documentation and assessments more sound and easier to do. Again, we are always here. If you have any questions or concerns, please comment below and let me know what you thought about this tutorial. And of course, please like, share, and subscribe to our YouTube channel. We would also love it if you joined our Facebook group as we move into questions M1810 and M1820. And we're also going to be bringing you all types of amazing content from here on out. Also, let me say this, if there's anything that you want covered in particular, feel free to let us know that as well, because this is all about you guys. But as always, thank you so much for tuning in. And of course, thank you for all that you're out there doing as home care nurses, because we know it's not easy. So in the meantime, guys, take care, be safe, and we will see you soon.